Welcome to this explainer. Today, we're unpacking the terrifying, honestly fascinating biology of a microscopic invader that is still challenging scientists to this very day. We're talking about hantavirus. It's a pathogen that really operates in the shadows, way out in the wilderness and abandoned spaces. We're going to break down its microbiology, trace exactly how it invades us, and explore the absolute internal battle that follows an infection. Let's get right into it. So let's start things off by asking a pretty startling question. How could a simple everyday chore, like, say, sweeping out an old, dried-out cabin, potentially trigger a life-threatening medical crisis in just a matter of hours? I mean, it sounds like something straight out of a sci-fi movie, right? But the threat is entirely real. We're looking at a virus that doesn't need a bite, doesn't need a scratch to infect you. It literally just needs you to take a deep breath at the exact wrong moment. Let's start by looking at exactly where this comes from with Section 1, the threat in the dust. So this virus was actually first officially identified during the Korean War, right near the Hantavirus River. It's primarily carried by rodents like rats and mice who totally harbor it without getting sick themselves. But what's wild is how this highly adaptive viral family actually branches into two distinct, highly dangerous diseases, and it's based entirely on geography. Over in the Americas, we have Hantavirus Pulmonary Syndrome, or HPS, which severely targets the lungs. Meanwhile, Hemorrhagic Fever with Renal Syndrome, or HFRS, which is mainly seen in Europe and Asia, aggressively attacks the kidneys. So you've got two completely different syndromes, but one incredibly effective viral threat. To really understand how it causes so much devastation, we need to zoom in. Section 2, Anatomy of the Microbe. According to the International Committee on Taxonomy of Viruses, this little invader belongs to the Hantaviridae family. The absolutely crucial thing to know here is that this spherical structure is a highly specialized RNA virus, and it's what we call an enveloped virus. That basically means it's wearing an outer protective coat, a coat specifically built for quiet survival out in the environment, and then rapid replication the second it finds a host. Now, what's truly terrifying about this is its genetic simplicity. It contains just 3 specific genome segments. You've got the S, the M, and the L segments. And that is it. Yet those 3 tiny strands of genetic code carry every single instruction the virus requires to thrive, replicate, and just completely overwhelm the human immune system. It's really a masterclass in biological efficiency. Which brings us to Section 3, how infection actually happens. How does this make the leap from a wild rat to a human being? Okay, so unlike the common cold or the flu, human transmission doesn't usually happen person to person. You're not going to catch this just by shaking hands with a friend. Instead, the infection relies on an environmental trigger. See, rodents excrete the virus in their urine, their feces, and their saliva. When that dries out in enclosed spaces, think closed rooms, warehouses, farms, or old wooden cabins, it mixes right into the dust. The stealthy trigger happens when a person walks into that space, stirs up the air, and inhales those aerosolized, contaminated particles. You breathe it in, and the invasion begins. And that takes us to Section 4, the body under siege. The second those invisible particles enter your respiratory tract, this aggressive, completely hidden war kicks off inside your anatomy. The pathology progresses so fast, and ironically, it's your own body doing a massive amount of the damage. First, your immune cells detect the invader and they activate. But instead of a measured normal response, they trigger what's known as a cytokine storm. This is a massive, unregulated immune overreaction. And this storm causes the walls of your tiny blood vessels, your capillaries, to become hyperpermeable. Basically, they just start leaking. Plasma seeps straight out of your bloodstream and directly into your surrounding tissues. Now, in the Americas, with Hantavirus Pulmonary Syndrome, this leakage specifically targets the respiratory system. The virus attacks the alveoli. Those are the tiny, delicate air sacs in your lungs that are responsible for oxygen exchange. Because of that capillary leakage we just talked about, fluid rapidly accumulates right inside those air sacs. Oxygen exchange abruptly stops working, which leads to immediate severe breathing difficulty. The patient is, quite literally, drowning from the inside. And this sets off a brutal cardiovascular domino effect. With all that fluid leaving the bloodstream and filling up the lungs, your overall blood volume just drops. Blood pressure plummets incredibly fast. With accelerating speed, the heart's pumping function weakens, and the body can very quickly slide into a severe state of shock. On the flip side, if we look at the HFRS variant, the one primarily found in Europe and Asia, the war zone shifts down to the renal system. Here we see rapid, severe kidney inflammation. Patients experience a really dangerous decrease in urine output, internal bleeding can develop, and things frequently escalate into acute kidney injury. If a pathologist were to look at this tissue under a microscope, the devastation is just undeniable. It presents as severe cellular damage spanning both the pulmonary and renal systems. We're talking pulmonary edema, which is fluid in the lungs, along with deep interstitial inflammation, internal hemorrhage, and profound damage to the actual inner lining of your blood vessels. This is exactly why it's so dangerous. The virus doesn't just give you a nasty cough, it fundamentally compromises the structural integrity of your vital organs. So, what is the timeline for all of this? Let's look at Section 5, Timeline of the Disease. Notice how incredibly deceptive this virus is right out of the gate. For anywhere from 1 to 8 whole weeks during the incubation period, it hides completely undetected. You feel absolutely nothing. Then comes the prodromal phase, followed by the terrifyingly rapid cardiopulmonary phase, and finally, if the patient is lucky enough, the recovery phase. Let's look a little closer at that second stage, the prodromal phase. It is so deceptive because early on, these symptoms perfectly mimic an ordinary, pretty harmless flu. You get a fever, muscle pain, intense fatigue, maybe some chills, a headache, vomiting, or abdominal pain. A patient might genuinely just think they need a couple days in bed with some chicken soup, right? They have absolutely no idea that their blood vessels are literally preparing to leak. But then it hits the critical cardiopulmonary phase, and this transition is sudden and it's violent. Symptoms just explode into severe breathlessness, low blood pressure, and a cough with intense chest tightness. You might actually see blue lips because oxygen levels are plummeting so fast. Fluid rapidly fills the lungs, and in HFRS cases, you see kidney failure and bleeding. At this point, patients absolutely require immediate ICU admission. The body is in a literal fight for its life against its own drowning organs. Which really brings us to our final thought. Knowing that this deadly, highly efficient microscopic threat survives silently in the dry dust around us, literally just waiting for months in mouse droppings, how safe really are the abandoned spaces we step into? It's a sobering reminder of the invisible natural threats hiding just out of sight. And it for sure makes you rethink every dusty room, old barn, or long-closed cabin you might stumble across. Always ventilate, never just sweep blindly, and respect the unseen wilderness. Thanks for joining me for this explainer. Keep asking questions and stay curious.